Hello. It is such a blessing and an honor to be with you virtually today. I want to thank Dr. Wright and the Institute for Women for the invitation and the privilege to speak with you about emotional and mental well-being. Thank you to all the individuals that have put their hands on this event, and pray that I play my part as a vessel of hope and encouragement by way of my God-given skills as a psychologist. My name is Yeshashwork Kibour. I am a mother, a life partner, a sister, a child, and an educator. This is a picture of myself and my family. Beside me is my greatest supporter, my husband of 14 years, Gideon. My two boys, Emmanuel, who's 12, and Gabriel, who's 10, that make life interesting on a daily basis. I have been a licensed clinical psychologist for the past 16 years. I earned my graduate degree from Howard University, where I specialized in trauma treatment, especially for immigrant, refugee, and asylum-seeking populations in the United States. I have worked in various settings, including mental health centers, Veterans Hospital, a terminal cancer hospital, and academia, and operated a private practice in Washington, D.C. for 8 years before my current position as a regional mental health officer for the federal government stationed in Rabat, Morocco. What comes to mind when you hear the words mental illness? Let me tell you a little bit story about me and how I understood mental illness as a young person. I grew up in Addis Ababa, Ethiopia. My mother loved to praise God and took us to churches, to any church where there was vibrant rejoicing in God. So during the week, she would take us to a church that was closer to our home. I did not know what faith they practiced, but it was very different from our church. And people would bring their loved ones to church so that they could get what was possessing them cast out by the pastor. My mother would urge us to focus on singing, but I cannot lie. I peaked a lot. And what I saw petrified me. Most of my young life, I was riddled with conflict about how God could allow what was happening to these people, and later to a close family member who suffered a similar fate. In my young mind, mental illness was just bad, something that happened to other people, something that you don't want in your home, a negative you try very hard to avoid and deny if it happened. Before advancement in modern science, everything that was not seen as normal was lumped together and basically cast out of the community. You were considered lazy and ungrateful if you were depressed and anxious, but just a bad person if you suffered from addiction on top of a mental illness. Back then, the field of mental health was also dominated by men who had no way to understand the female experience. We were misunderstood, experimented on, and called mad. Were cast out and seen as abnormal if we did not perform our roles, what our roles demanded, with a smile. Many adopted a stoic stance, even when they were feeling like they were falling apart inside. The shame of catching this thing was so strong that once denial gave way, many contemplated suicide. Personally, my childhood images of what I saw at that church and what I was told by my community about mental illness has planted a seed of stigma in my heart, as it did many of my generation. 2/3 of people with mental health conditions do not receive the care they need because of stigma primarily, and also due to lack of resources. The bottom line, we must allow ourselves to see what is there and work towards healing with the help of God. The truth is, 1 in 4 individuals around the world will develop mental illness at some point in their lifetime. That women are impacted at a higher rate than men. And some of the mental health related risk factors for women include pressures created by the multiple roles that we play, gender discriminations and associated factors of the pay gap, an increased rates of poverty, hunger, malnutrition, domestic violence, and sexual abuse. The fact is also that we were affected disproportionately by the pandemic. Women experienced higher levels of moderate to severe levels of depression and stress, and women aged 18 to 24 reported higher levels of suicidal thoughts than men. During lockdown, they were more likely to experience nervousness, to feel like everything was an effort, and to feel lonely. Unfortunately, the pandemic has not helped the existing steady incline of mental illness in the United States. The sad truth is that those with mental health issues are more susceptible to facing other health challenges, including cardiovascular and metabolic disease. So people with depression have a 40% higher risk of developing depression, while people with serious mental illness are nearly twice as likely. We simply cannot afford to have stigma get in the way of our well-being, especially when there are other treatments that work to treat mental illness. So the first step is to understand mental health and well-being. Mental health is one of the dimensions of our overall well-being that include our emotional, physical, social, and spiritual health. All of these need to be in balance in order for us to be well. Our emotional health includes our ability to be agile emotionally, flexible with our thinking, and know how to solve problems. Our physical health includes our physical agility, getting adequate sleep, and making sure we eat a balanced diet. Our social health, including making sure we experience a sense of belonging wherever we are, that we show empathy and surround ourselves with rewarding social networks. And our spiritual health includes our constant thinking about our higher purpose, our commitment to our values, and making time for introspection. Now, our well-being is tested often when we experience stress. Our well-being corresponds to how we react to stress from our environment that can range from flourishing to improper behavior. The important thing to know is that stress is part of life. We will never be rid of it as much as we want to. It is not always bad. In fact, we need a certain amount of stress to do what we need to do in life. For example, my fear of leaving my baby in his car seat on the top of the car made it so that I never endangered him in this way. It is also important to know that stress is a continuum with slow gradients racking up or coming down, and you may find yourself reacting differently to different stressors. It is also not linear. So one day you might feel like you're thriving, then find yourself in the impairment zone for a pretty good reason. Take a moment to think about where you are right now in your life. Take a moment to reflect also on how you personally react when you are in any one of these zones. For me, my stress reaction is often associated with body aches, ruminating about things, kind of thoughts keep going back and forth. I feel like I'm unable to sort it through. I crave anything sweet with chocolate and peanut butter. Take a moment to think about what this might look like for you. We are like gardeners that carefully tend to our garden. In order for us to be able to do so, we need to know our field, our soil, our plants, and also know what it needs to flourish. Similarly, we need to have a way to monitor our well-being, assess our need, and know how to get the help we need. You are the most important gardener your garden will ever have. Know your garden. So self-awareness is key to well-being. Now, first and foremost, self-care means giving adequate attention to one's own wellness. Something I really want you to walk away with today. And that is the understanding that self-care is not a luxury, it is a necessity. And we women especially need to hear this. Self-care is not a luxury, it is a necessity. So here's the same chart about well-being that now gives you the actions you can take to mind your wellness. Please note that these and other resources for self-care are provided in the last slide. Some additional tools or skills you can practice daily to maintain a healthy brain, coming from the acceptance and commitment therapy, include grounding, unhooking, acting on your values, being kind, and making room. There's a brief description of each of them, and there's a resource, of course, on the last page. So with acceptance and commitments therapy, which is referred to as ACT, rather than suppress or avoid psychological events, ACT is based on the belief that acceptance and mindfulness are more adaptive responses to the inevitabilities of life. Therefore, by experiencing your thoughts, your physical feelings and emotions in more flexible ways, we can reduce the negative behaviors they often lead to. I pray that this was helpful to you. Thank you again to the Institute for Women and Dr. Wright.